In this lecture, we will discuss the surgical anatomy of the larynx. The larynx is an important organ situated in the anterior neck and serves as the organ of voice, respiration, and airway protection. The larynx is situated in the anterior part of the neck and forms a part of the upper respiratory tract. In adults, it lies opposite the third to sixth cervical vertebrae. Superiorly, it communicates with the laryngopharynx through the laryngeal inlet, and inferiorly, it continues as the trachea. In children, the larynx is located at a slightly higher level in the neck. Surgically, the larynx is divided into three important regions. The supraglottis lies above the vocal cords and includes the epiglottis, aryepiglottic folds, and the false vocal cords. The glottis contains the true vocal cords and the rima glottidis. The subglottis extends from the lower border of the vocal cords to the lower border of the cricoid cartilage. This division is very important in the staging of laryngeal cancers. The framework of the larynx is formed by a series of cartilages connected by ligaments and membranes. There are 3 unpaired cartilages and 3 paired cartilages. These structures maintain the patency of the airway and provide attachment sites for the intrinsic and extrinsic muscles of the larynx. Thyroid cartilage is the largest cartilage of the larynx and forms the anterior wall of the larynx. It consists of 2 laminae that meet in the midline to form the laryngeal prominence. That laryngeal prominence is also called the Adam's apple. Posteriorly, each lamina extends upwards and downwards, forming the superior and inferior horns. The inferior horn articulates with the cricoid cartilage at the cricothyroid joint. The cricoid cartilage lies below the thyroid cartilage and forms the base of the laryngeal skeleton. It is shaped like a signet ring with a narrow anterior arch and a broader posterior laminae. The cricoid cartilage articulates with the thyroid cartilage through the cricothyroid joint and with the arytenoid cartilages through the cricoarytenoid joints. It is an important surgical landmark during airway procedures. The epiglottis is a leaf-shaped elastic cartilage located behind the root of the tongue. It forms the anterior boundary of the laryngeal inlet. Its lower end is attached to the inner surface of thyroid cartilage by the thyroepiglottic ligament. During swallowing, the epiglottis helps protect the airway by directing food towards the esophagus. The arytenoid cartilages are small pyramidal structures that sit on the superior border of the cricoid lamina. Each arytenoid has 2 important projections, the vocal process and the muscular process. The vocal ligament attaches to the vocal process while intrinsic laryngeal muscles attach to the muscular process. These cartilages are responsible for movements of the vocal cords. The cartilages of larynx are connected by several membranes and ligaments. The thyrohyoid membrane connects the thyroid cartilage to the hyoid bone. The cricothyroid membrane connects the thyroid and cricoid cartilages and is clinically important for emergency cricothyrotomy. The quadrangular membrane and conus elasticus form important supporting structures within the larynx. Intrinsic muscles of larynx.
The intrinsic muscles of the larynx control the position and tension of the vocal cords. The posterior cricoarytenoid is the only muscle that abducts the vocal cords and opens the airway. The lateral cricoarytenoid and interarytenoid muscles adduct the cords.
The cricothyroid muscle tenses the vocal cords while the thyroarytenoid relaxes them. The arterial supply of the larynx mainly comes from the superior and inferior laryngeal arteries. The superior laryngeal artery arises from the superior thyroid artery, while the inferior laryngeal artery arises from the inferior thyroid artery. Venous drainage follows a similar pattern and ultimately drains into the internal jugular vein. The nerve supply of larynx is derived from branches of the vagus nerve. The internal laryngeal nerve provides sensory nerve supply above the vocal cords. The recurrent laryngeal nerve supplies all intrinsic muscles except the cricothyroid. The cricothyroid muscle is supplied by the external branch of the superior laryngeal nerve. Injury to these nerves can cause hoarseness and or airway compromise.